I want to talk about two different types of tubes that you'll commonly see. One type of feeding tube has a balloon tip, the other one does not. And I brought this up a little bit earlier. This is really important with respect to our ability to replace a tube if one is broken. If a tube is leaking, or if it's cracked, or if it's clogged, and it needs to be replaced, if it has a balloon tip, it's very easy for us to deflate the balloon, remove the tube, and put another balloon tip tube back in again. Most of the time, when there is a balloon tip feeding tube, it was not the originally placed G tube. It's a replacement type of a tube. There are exceptions to that, but most of the time it's the patient's second tube or third tube or fourth tube. Most of the originally placed tubes do not have a balloon tip at the end. The one that we use here is an exception to that. It can be removed without an endoscopy. But again, I want to make an important point. This one has a balloon tip, this one does not. We need to be able to identify the difference between the two. The next thing that I want to talk about is when a tube needs to be replaced by a nurse. If a tube is inadvertently pulled out and it's been less than 24 hours and the stoma is still open, something needs to be put back in the stoma so that the stoma does not close. This is a Foley catheter. Everybody knows what a Foley catheter looks like. This is a replacement gastrostomy tube. Okay? The only difference between these two tubes is the external fixation device. That's it. This particular replacement gastrostomy tube has two little ports, one for a big syringe, a Toomey type syringe, one for a Lure-Lock type syringe, whereas the Foley catheter only has for a Toomey, and we put our little stop Y adapters on there, our little stop cocks that have a Lure-Lock on it. But again, the only difference between a peg replacement tube and a Foley catheter is the external fixation device. The benefit of having an external fixation device, and it's not a huge benefit, but it's a benefit, is that if you put this in if you put the Foley catheter in a person's stomach to replace it, and you don't secure this with tape, the stomach thinks the balloon is a piece of food, and it will try to push the balloon down into the small intestine. Okay? So my balloon is now inflated. You have replaced the pulled out G tube with a Foley catheter. What can happen is, and actually let me use this picture here. And this is not a critical thing, but it's important. What can happen is, if you don't secure this with some tape or something, is the stomach will pull the balloon down into the small intestine. What you'll see when you come into the patient's room is the only thing coming out of their skin will be the end of the Foley catheter. The balloon is down in the small intestine. Now your tube feedings are going great under that circumstance because the tube feedings are coming out of the end of the tube. Unfortunately, the stomach, which makes 1 liter of fluid a day, that liter has to go somewhere. It leaves the stomach, it comes down and it hits the balloon, which is obstructing the small intestine, and the patient's vomiting. So your tube feedings are going great, but the patient's vomiting 1 liter a day. So that's the only problem with a Foley catheter. There have actually been studies to show that these things sometimes work better than the replacement G tubes, other than the fact that you have to make sure that when you put it in there, that you do something outside the body to stop the stomach from pushing the balloon down. And that's what the external fixation device is for that comes with these replacement G tubes. The downside of these is that they're probably 10 times the cost of a Foley catheter. They're a lot more expensive. And the only benefit is this piece of plastic that stops it from being pulled down.